When the Delaware Health Information Network launched in May 2007, it broke new ground as the first statewide health information exchange in the United States. Since then, DHIN's secure online system has received accolades for promoting the exchange of clinical information for healthcare providers. The system is dramatically speeding the movement of records and test results and quickly eliminating traditional paper delivery methods. Today, most Delaware acute care hospitals post patient information on DHIN. Most medical providers are enrolled and participating. More than 7 million clinical results and reports are posted each year. Patients with records in the DHIN database now exceed 1 million. Here are some key voices in the Delaware medical industry explaining the amazing impact DHIN has had on their practices, businesses, and patient outcomes.
Well, I think the most important currency in healthcare is the idea of communicating information. So if you can communicate information effectively and efficiently, it's a valuable resource. So what DHIN is doing for us is it's getting us information that we never had access before. If we can get it from other hospitals, other providers, and get it in a timely fashion, it can make a big difference.
DHIN saves time, DHIN improves patient care, and DHIN will help save lives.
I think it's saved a lot of money, at least in terms of my office expenses, because I am not getting duplicate faxes of lab results sent to me from facilities as well as from DHIN, and sometimes patients will also try to send me their lab results as well. It's also helped to save myself as well as my staff a lot of time because we're not spending it on the phone trying to get in touch with the facilities in order to get the information that we need sent to us. Instead, we can just log right onto DHIN, get the correct patient, verify that that is the patient that we need, and be able to have access to all of that in probably less than 30 seconds.
DHIN is important in that it brings together in one place all of the information that is known about a patient that may have been collected across a wide range of care settings and across a broad span of time, so that anything that could inform good current care of that patient is available when and where it's needed.
Recently, I had a patient come in from a ER follow-up who had a problem, wasn't sure what kind of blood work was done, didn't know what kind of testing was done. They couldn't really give me a lot of information other than they were told to come follow up with me. I was able to instruct my staff member to log on to DHIN, then pull up all of the paperwork, all of the blood work, all of the radiology data that was done on the patient, and I was able to get it immediately and accurately, and it made it much simpler for me to then be able to care for the patient appropriately during that visit.
DHIN has really been accepted by our providers because they see the value in getting that information from multiple sources right to their desktop so they can make that informed decision. If you haven't signed up for DHIN yet, I strongly encourage you to do so as soon as possible because DHIN is what is going to help improve your patient outcomes.
Being in private practice, time is definitely money, and I need to be efficient with the time that I have. That to me is really invaluable and is worth its weight in gold.
If you can provide better care and you can use information rapidly and efficiently, it's a no-brainer because it essentially is going to make people better, and that's ultimately what we're trying to do.
Join the future today. Join the Delaware Health Information Network.
DHIN saves time, DHIN will improve patient care, and DHIN will save lives.
If you haven't yet joined DHIN, what are you waiting for?